Dentist says, we need to remove your tooth. Wait, what if your natural tooth could still be saved? Every year in the United States, millions of teeth are removed. But many patients never ask one important question. Should I save my tooth or pull it out? Most people think pain means extraction. Not always. Modern dentistry in America follows one goal: save the natural tooth whenever possible. Why? Because your natural tooth is designed for your mouth. It helps you chew normally, keeps your jawbone strong, and prevents nearby teeth from moving out of place. Even badly damaged teeth can sometimes be saved. A deep cavity? Maybe a filling. An infected nerve? A root canal treatment. A weak or broken tooth. A dental crown may protect and restore it. Many patients hear the words root canal and get scared. But modern treatment is faster, safer, and more comfortable than most people expect. Now here's the other side. Sometimes a tooth cannot be saved. A severe crack below the gum line, major bone loss, heavy infection, or serious damage. In those situations, your dentist may recommend tooth extraction. Then comes another option: a dental implant. A titanium implant acts like a new tooth root and supports a replacement tooth. But remember this: just because a tooth hurts does not automatically mean it needs to be removed. Saved tooth or tooth extraction? What would you choose? Subscribe for more medical and dental 3D animations.